And so this is placed in the vaginal introitus, and there's bipolar plates. And what it does is it actually contracts the levator ani muscle for you. So in essence, you're doing about 20,000 Kegel exercises. And the funny thing about Kegel exercises is when I'm doing a vaginal exam and I tell my patient, can you squeeze my fingers? They're not squeezing my fingers. They're either squeezing their rectum, they're squeezing their abs, and also the compliance is not there. So if you're helping them do something and you're already putting it into into a whole package for them, how amazing is that? That you're actually getting women in their 30s, even sometimes before the children, all the way to postpartum and all the way to premenopause and postmenopause. Imagine all the women that are coming to you for this internal gym package. They're paying monthly for it as a membership, and they just come in, you put something externally or have someone delegate, put something externally, and they actually feel tighter, okay? Not only are they having better sex with better sensation, but they're also stronger, and their pelvic floor is also stronger, and they don't urinate on themselves, okay? Now this is the Votiva animation video. I'm not sure if this is gonna work. However, the Forma V, that's actually what it's called. The Forma V is great for external and internal improvement of not only vaginal laxity syndrome, but also for incontinence and also for vaginal dryness. A lot of things that your patients will tell you is that, they'll say, I'm having a lot of, discomfort with sex. It hurts. It's like, having sex with a cactus, right? And so now you have this Forma V probe that's able to be placed intravaginally, and it's going to deliver bipolar radiofrequency heat 360 circumferentially into the vaginal canal, introitus, even the perineum, and externally. And this is what's going to give them back their lubrication, their sensitivity, and also some tightening outside. And remember, we want the labia majora to be nice and plump. We don't want hypertrophy of the labia minora. We don't want hypertrophy of the dorsal clitoral hood. All right, and then so we can do this on top of that. And then my favorite procedure on the Empower is called the Morpheus M8V. How many of you guys have actually seen this done before? Okay, and so what this does, if we can press play, is this is going from 1 to 3 millimeters in depth. And it's going to give circumferential radiofrequency. It's going to be ablative. It's going to give you bulk heating. It's going to go in the 360. Look what's anterior to that, and look what's posterior to that. You're going to have your G-spot anterior to that, and you're also going to have your urethra and your urethral tone and ligaments anterior to that. So if you want to hit that a few more times anteriorly right there, because someone has stress urinary incontinence, this is what you're going to do for them. And after this procedure, they're not going to leak on themselves. It also not only helps with stress incontinence, it also helps with urgency and urgent continence. It also helps to decrease the amount of times patients wake up to pee in the middle of the night.